Like everyone else, here in Davis, California, we watched COVID-19 devastate communities.
Davis is a small college town, so to create the safest environment possible for everyone here in Davis,
We knew we had to draw on all the strengths in our community.
The city and the university teamed up to do what no other place did during the pandemic.
I think you need to think from an evolutionary standpoint as to what's advantageous to the virus. There are people walking around with large amounts of virus, highly infectious, and they don't have any symptoms. I was frustrated that the medical community thought that 1,000 tests a day was high throughput. And I already knew in the ag biotech companies were capable of generating millions of data points a day. The technology that we actually use for testing was designed for detecting changes in the DNA content of plants.
For maybe 10 years of my career before coming to Davis, what I focused on was something very related to the pandemic, basically the genomics of emerging infectious diseases. So I worked at an institute that did the first genome sequence of the causative agent of malaria and the first genome sequence of the causative agent of anthrax. The first community-acquired infection of SARS-CoV-2 in the United States was brought into UC Davis Hospital.
When we were told about the lockdown back in March 2020, and told to go home, I think that's when reality really hit. You know, at that point, of course, we had no idea we're going to be playing this role in getting the university back on track.
Well, one of the lessons you take from ag biotech is it's got to be simple, it's got to be fast, it's got to be inexpensive. And so our workflow, we looked at it, at the time initially, the way to do testing was to take a nasal swab, which involves shoving something right at the back of your nose, which wasn't popular. So that was out. You can't do that kind of thing at scale. And if you do it once, people are not going to come back a second time. There was already the sentiment that saliva would work. The saliva's got viscosity problems, and Lutz in the lab had the idea about papain.
Everybody said that viscosity was going to be the challenge. I mean, you could get strings from the saliva, and it would just drag across all the samples, totally contaminating everything.
Lutz Frönicke in the lab came up with the great idea of using papain, which you will know more commonly as meat tenderizer. And so what that is, it's actually a protease, chews up proteins.
That harkens back to my PhD time, and I remembered that my PhD advisor back then used papain for DNA extractions.
I was responsible for the pre-lab portion in the beginning. How would we collect and organize sample collection and bring them all here to this building, to the Genome Center, where they get processed in our genome testing facility? You know, at the beginning, we started in a parking garage with 10 people who used to work in the dining hall. And they became kiosk workers and learned how to collect saliva samples and register clients. We report back over half of our results within 24 hours, which matters. If you send in for a test and you find out 10 days later, which was happening a lot in the early pandemic, it doesn't matter. Then beyond that, Healthy Davis Together arose and wanted to expand testing to the community.
It's become a really positive and powerful partnership between the campus, the city of Davis, and Yolo County, working now in tight conjunction with each other to suppress COVID in the whole region. One of the things that we began thinking about early on was to do surveillance of things like the wastewater stream for the presence of the virus that might help us zero in, like if the wastewater stream from a particular dormitory had virus in it. We had a faculty member on campus whose research specialty was wastewater surveillance.
I started working with the campus to collect samples within buildings on campus. And then Healthy Davis Together came in, and we said, well, we can do this, but at the city scale, you know, at the wastewater treatment plant. And what if we also worked in different regions of the city so that we could could tailor our communications of, if there's a spike in a certain area of the city, we can send that information to the city directly and they can communicate out.
We're at the wastewater treatment plant for the city of Davis. And so we're going to go look at the 2 sample locations that we have here. We sample the influent composite every day of the week, as well as the primary sludge, which both gets sampled and analyzed.
What we're doing now to kind of tailor our project is focusing in on variants. We've been interpreting the data, working with public health experts and with the city to find that right balance of communicating when we're confident, but also kind of stepping out in front. If this is an early warning tool, one of the aspects of our work that's really important is our partnership with the public health department for Yolo County. We're also expanding our work into the Central Valley in partnership with UC Merced, working with public health officers, as well as the California Department of Public Health to make sure that the data that we generate here goes back to the cities, back to the people who live there.
We should be able to keep a lid on this epidemic. That's the hope, is we can really keep a lid on it by aggressive testing, very fast turnaround of results, effective contact tracing. And this just is not available pretty much anywhere else.
It was very scary, especially the retail sector was completely shut down for like 3.5 or 4 months.
We got the mandate that things were shelter in place, and it was instantaneous stop. The students in the university not going to school. A lot of them were going to be heading home, and cutting this population and close to half.
After the first 4 weeks, we saw the numbers, we saw the sales, and we saw how many people were coming through the door. And we didn't know if we could last another 2-3 weeks. We went from serving 200 to 250 people a night to serving 20.
That was the hardest part, was just not knowing. And so when things shut down, there wasn't really anything else in place. As an organization, we quickly created a program, got the community involved in purchasing gift cards and certificates to downtown businesses, our members, and we would match those funds.
I was one of the first businesses to sign up, so we got free PPE for sure. So we got gloves, we got enormous amount of sanitizer. We had, the gifting was absolutely amazing, so it's a gifting business partnership. So when the Healthy Davis Together was buying the gift cards from us and incentivizing the customers who is going to get tested and then give them the gift cards, what happens is those customers are coming back, they're not just spending $10 what's in the gift card, they're spending more.
One of the fundamental premises of our project was, how do you return to normal activities as safely and as quickly as possible? And obviously business activity had come to a screeching halt. How do we get that going again safely? So we wanted to work with businesses about how do you create a safe environment for yourself, your customers, and your staff to work in and to patronize your business, to be able to stay safe and not create greater risk for themselves.
I found out that Healthy Davis Together was offering us a grant. And the grant was $5,000 towards anything that we did to provide a safe environment for our clients. And this cost about $11,000, so it paid for almost half of this entire build out. So it just made it feel really reasonable, because at the same time that I'm paying rent on the building and indoors, I got this huge relief to be out here. So it really works.
Are you Meta?
I am.
I'm with the University of Davis Health System. For the HDT program, I am the public health specialist, working with the businesses on the air quality issues and helping them open up their businesses more safely during the pandemic. So I started on January 1st of this year. So far, I've had 52 consults. Of those 52, I've been out to 26 businesses in Davis. Of all those 52 and now 53 with one here today, all of them have air purifiers in their businesses. We also have air purifiers in every school in Davis Joint Unified School District. That's because we know the studies have shown that these air filtration devices help reduce COVID transmission significantly.
We've been a little bit more relaxed about people moving from table to table and party size. Before we were limiting it to no more than 4 people at a table, but now we've increased that requirement to 6 people from the same household. All of our staff has been fully vaccinated. They've gone through both doses. We took advantage of the county's restaurant-only vaccination clinics, and the county's been really great. They had clinics just for restaurant workers, and they were very flexible about times because, restaurant workers, it's hard for them to get away from work.
Today is June 15th, 2021, the big reopening of California. Businesses back to full capacity, a lot less restrictions for the business community in general, and the general population. So it's exciting times to been well over a year now of, when things changed drastically.
That's always been a challenge, and working together as a team, the ideas that were thrown out there and the problem solving that came along with that made this probably the most robust community outreach that we've ever done, and I think that really led to the success. And the teams on the city side and the university side
I just started now to start reflecting on everything that's been going on, from where we started back in March to empty streets and an empty restaurant to the last 6 weeks where we've been just seeing this tremendous response. And, I think the word I have is gratitude. Gratitude for my staff that stuck through this entire ordeal. Gratitude for living in a community that offered something like HTT to free testing, reimbursement grants. A lot of other restaurant owners that I know did not have that community support and access to these types of programs.
One of the other key goals of our project is to develop knowledge and share it with how to best manage this pandemic and future pandemics. Clearly, we have to continue testing. Clearly, we have to continue with masking and other safe behaviors. A lot of students coming back to town and a lot more patrons inside of businesses is going to test whether or not all the different aspects of our program work.
My outfits are here from Monday through Friday. My shoes, my backpack, and this one's Monday, this one's Tuesday, this one's Wednesday, and this one's Thursday, and then Friday. I'm really excited to go on Monday for the first day of school.
We have 5 children. We live here in Davis, California. Looking at our lives, how the pace was, it was just like we always had practices to go to. We always had, to go to work, come home, do the chores, get the kids going. But when everything shut down, everybody was literally home. So we really got to see the side of how families are when everyone's home.
Hey, come on in.
Hi, how are you?
Great.
Good to see you.
You too. Give you an elbow bump.
We started
at UC Davis Health working and thinking about what reopening is going to take, what scalable testing across the population, what that would look like, and how we could implement that.
By trying to communicate well with all the different constituencies, that I feel we really did hit the right mark in opening 5 days a week on a modified schedule.
How do we help schools reopen safely? How do you create a safe environment? And then what tools can we bring to bear? Mass asymptomatic testing, first and foremost. What can we do with air filters? What can we do with ventilation, doors and windows, and HVAC systems? What can we do with masking?
My son, my 15-year-old, he started with the symptoms, and if he was exactly the same way as my daughter, I mean, it was to the point where he was just in bed with fevers every night. We had to take him to the emergency room a couple times. They kept him there overnight.
So when my family had COVID, I was just stuck in my room with my sister, and my mom had COVID, and I was just really scared for her and my brother. And then during Christmas, when I had to say hi to my cousins through the window, it made me feel like COVID is really, really bad.
We were fortunate at the university to have access to a saliva-based PCR test that was very sensitive, very specific, and very low cost, and so thus scalable into a whole city, right? So the thesis was, if we can deploy that across the population, get people to come to test once a week, if not twice a week, you can catch them in that 3 to 5 day window when they're shedding virus but not symptomatic yet. Get them out of the population and beat the virus down within the population as fast as possible. We realized the elementary schools and the K through 12 schools were going to be a key component of that.
I'm Heidi Perry, and I'm an administrator on special assignment, and so I am in charge of COVID testing for the schools in the Davis School District. We're going to be opening in schools, and our staff we were hiring, and they were getting trained at the same time.
We've always been planning for a reopening, but the time frame for that was unknown, especially as we saw the different surges and the long wait for development of a vaccine.
We thought we were going to be in a hybrid model, which was less time on campus for kids because the rules were stricter, 6 feet apart, right? So we were going to have different cohorts. And then Davis, Yolo County went down to the next tier, which is the orange tier. So then that changed, and so we basically scrapped everything we were doing and planning January through, and after spring break created a modified in-person schedule so that kids are with us every day now. About a week or two before opening, it was nonstop. There was a lot of making sure teachers were prepared in classrooms. The nurse and I worked really closely together to make sure we were separating desks and chairs the way they were supposed to be, that we could fit everyone.
All buckled? You're buckled? Anybody want to lead the prayer this morning? All right, thank you, God, for this day that you've given us, for the opportunity to have a first day back at school. Give us your protection, your love, your peace. And this day we pray. Amen. All right, guys. Have a super blessed day. I love you. Yeah.
Every school in the district either has testing on their site at least once a week, or they have an adjacent facility that is very close to their campus. And so we have classes coming through at some school sites, and people come in and test staff and students either before school from 8 to 8:30 or after school when they let out at 11:30.
For us to be able to find the virus in the environment means that someone was shedding quite a lot of it. We can't test every kid all the time, but if we can monitor the air, we can know if someone in a classroom is shedding the virus. But we've been doing this for about a month, and at one of our schools, we've detected only a single air filter positive, and at one of our schools, we've detected 6 or 7 positives. The district has gone in and strongly encouraged testing of all of those kids. They've brought nurses out to the sites to get kids registered that aren't registered in the HCT system, and to try to get as many of those kids as possible. I'm gonna take this and I'm gonna put it back in the tube. And this just snaps off. And that's what goes back to the lab.
I think we are more confident that we understand the virus, the way it spreads more, and we do feel like we know what we're up against.
Certainly this is a collaborative effort. So between Healthy Davis or Healthy Yolo together, the individual school districts, we've also collaborated with the Yolo County Office of Education, the Yolo County Public Health Department, in this contact tracing, testing, and vaccine efforts.
Health behavior change is very complex, and we try to do things that are going to instill effective messages, actually try to incentivize people to do the right thing.
Everybody loves the mask. That's usually a good thing, and also a really positive incentive to encourage people to wear masks. It's a free mask.
There are hand sanitizers, of course. These are unique because they have a QR code on them. You scan this with your phone, it takes you right to the HCT website and shows all the COVID testing sites and how to book an appointment.
You have to be able to instill appropriate behaviors to control a pandemic or an epidemic. So the idea of the project was to combine epidemiology with health behavior change. If you're going to try to control an epidemic, you're going to do that involving the community, because the students are part of the community when they come back. The other thing that we did was we knew that peer-to-peer education was really important. So health education happens not just by reading printed volumes or seeing videos on television or social media, but it actually happens at the person-to-person level.
Even participation from our students, our ambassadors, Aggie Public Health ambassadors, reminded people to wear their masks and went out into the community and educated people and answered questions, and sit at the front doors of buildings like this one and make sure everyone's done their daily symptom survey.
The ambassador program was set up with 3 main objectives. They were to educate, they were to building a community, and they were to encourage people, because we knew it was going to be a long haul. So how do you keep people encouraged to wear their masks and to continue to do the physical distancing and hand washing?
Sometimes in our downtown shifts, we like to split up. Some of us head over to actual downtown. Some of us stay at the farmers market. In downtown, sometimes we go to the Arboretum, and so it's always nice to have these out to give out to community members.
You start with epidemiologic infectious disease control. That's really an important part of trying to get your handle on an epidemic or a pandemic. But the other side of it was looking at health behavior.
We don't enforce, we educate. We build community. How do you make people feel included? How do we break the isolation of having a mask, having to acquire the physical distancing, but also encourage people that we're part of the same community and that you're valued. And because you're valued, we want to keep you safe.
We're celebrating graduation, woo!
We're lucky enough and fortunate enough that we're able to have some sort of commencement, and my job is to make sure that everyone's all right and healthy and good to go, so we're just checking vaccination records or proof of a negative COVID test. Thank you. This is your guys' tickets in. Wear that. Remember to wear your mask, stay 6 feet from other people, and have fun. You're welcome.
When Healthy Davis started meeting with all these groups, county, city, campus, and school district, our local school district, the messages were extremely simple, very graphic. Wear a mask, get tested, wash your hands, maintain your distance. And they were able to execute that on buses, on billboards, on cable television. Easy, available saliva testing was beyond amazing. That was at a moment where everybody was so nervous about whether they had the virus, will their children have it, will their grandparents have it, and we had the opportunity to say, guess what, you can come, you can get tested regularly for free, and it's easy. We started to understand that there are populations, there are people in our community who maybe aren't getting our message, even though we're using newsletters and we're using flyers and print and broadcast. Our pastor at the community church, 2 of our priests from the Catholic Church here, St. James, the rabbi, and some representatives from our Islamic community. We filmed these faith leaders saying in their own words to their communities why they felt it was important to follow the guidance.
But for those of us who are trading those freedoms for the joy of being here are a few things that we'd like to ask you to do to ensure that we're safe. Wear your mask over your mouth and your nose, please, the whole time you're here. Maintain social distance of 6 feet.
We have been a community, in essence, in exile for 15 months. Last week we came together, and it had been 64 Sundays since we had been together. Probably in the life of this congregation in 150 years, since 1869, I doubt the congregation had ever been apart from this place for more than a Sunday. But today, to have the choir outside the windows singing was so powerful. We couldn't sing inside, but we could hum, we could dance, we could clap. And the sheer energy of what it means to be together as human beings was there.
It is the first day of school back in person. It's really awesome.
We've been working at the Memorial Union with Welcome Week, where first years and transfer students and just general students coming back to campus, seeing it for the first time. They have questions about COVID guidelines on campus. I've even had friends, I'll say, I'm getting a COVID test right now if you want to come with me. And we go as a group and get COVID tested together.
Here in Davis, we were able to continue the messaging that getting tested is important. We had the chancellor amplify that message to the community. And so we've had, even though we did have a fall off in the volume of testing originally planned, we managed to keep testing going here, and testing has increased pretty dramatically since the Delta variant got on the loose. We're able to execute a lot of these interventions in the whole community there. What we've done is instilled a sense of community pride, trying to promote good health behaviors that will be lasting long after the pandemic is over.
my role as medical director, I can see on this super granular level whether there's 2 cases a day, like we were seeing back in May, which was lovely, to like yesterday where we had 51 cases in our community. We can share data and look at case positivity around the whole county, and then based on that data, be able to make real-time decisions about where to deploy additional testing. And we're doing that all the time, like today. Do we need to open another testing site in West Sacramento? We've had some really wonderful, unexpected partnerships, I'd say, like both within the campus community and also within the county, particularly with Public Health.
So it started with the senior center. That was our very first testing station downtown, and very small. And a couple weeks later, they said, can you start up another one, which was Mondavi? And so we started here, and then a couple weeks later, can you open up another one at the Veterans Memorial Center? We are kind of doing a little bit of refocusing at this point. So we have the vulnerable populations, we have our vaccine testing team, and then we have our saliva-based testing. So actually just this morning we had a meeting where we're trying to brainstorm about how to partner our vaccine team with our saliva-based testing and really going out into the community as a partnership.
Outreach teams, do you guys want to just go ahead and start knocking on doors while we get this part set up? Give me just a minute. We'll get set up first because that way we can vaccinate people who will say yes, and then we'll connect. Sound good? Okay. Thank you.
So game plan for today, we have two locked down sites. The first, we're going to go over to the roadway. They have day services today, so showers, outreach kits, some services on site. So we have an opportunity to meet some new people. I see our role while we're out in the world as vaccine ambassadors, and one of the things that we can offer people in the community is information that they might not otherwise have access to, and a kind ear and conversation. Everyone sound good with that? Yeah.
Headache started 2 days ago. Como tiene un dolor de cabeza, le podemos ofrecer la prueba a la vez de la COVID también. ¿Gustaría hacerse las dos?
This virus was differentially and really disproportionately affecting all kinds of marginalized populations, disadvantaged populations, and underserved populations. And Latinos are one of those populations that was seeing rates of COVID that were double to triple what they were in non-Hispanic whites.
When people come up, we usually ask them what their symptoms are. Yeah, and then at this point, depending on their symptoms, is how we proceed inside.
For me and my other colleagues, we like to rotate around. Outside of Davis, I can go 20, 30 miles up to the county line for testing sites. We go to small unincorporated communities or even within urban areas such as Woodland. I think nearby we went to the Davis Migrant Center.
My name is Jose. I am the mobile operations supervisor for the Healthy Davis Together program, and I have been working with them since January, so it's 6 months now. I think it's really important for us that what we've been doing is, instead of having people come to us, we go to them. Sometimes they can't come to us, so being able to go out to the community and test them when maybe some people don't have transportation or no way of getting to us.
I think that a lot of what is making us successful in reaching disadvantaged communities or communities that have lacked access to the vaccine has been working with community partners.
I'm the Homeless Outreach Services Coordinator for the City of Davis. Because of the way that we're interconnected as a community, when one person is ill, it's not only devastating for them in their life, but potentially for the entire community. So we were going to have to step up and do things differently in order to provide for the needs of people who they wouldn't be able to shelter in place because they didn't have any shelter.
I don't have no proof that I have my shots. I asked about it to one of the counselors here, and they said that they gave me one.
We've been going door to door for a couple of months now, about once a week or once every other week, to knock on doors and offer vaccine to people who are in those sorts of living conditions.
I didn't get sick from it or anything. The shots, I didn't get sick from those or anything like that.
I can actually see the numbers of cases and see individuals being impacted right away. I'm looking at my staff with so much gratitude at their nimbleness and their willingness and their flexibility to just kind of keep reinventing themselves. So I feel like surprised, right? This is our fourth surge, and we should probably feel a little bit more depleted than we do. But I feel like the organization is so mission-driven and so community-focused that that's probably the thing that keeps us energized.
This partnership and doing this vaccine outreach has been a really enjoyable departure where I am actually able to have, I can offer you something and I can really make a difference right now, immediately today.
Well, the first community spread COVID patient was treated at UC Davis Hospital way back in March of 2020. And it was then that we realized that this could be an issue for not just our campus, but the nation and indeed the world.
So there was really great need for concern back then about the students moving back to Davis and bringing contagion with them from some of the hotspot areas in the country and infecting the townspeople.
That was one of the original missions of Healthy Davis Together. It was a way to partner so that the campus could provide some reassurance to the community that, hey, we really do care and are aware that our students are impactful on the community at large.
It started really with a phone call that I received from Dr. Tom Nesbitt, who's associated with UC Davis. He said, we have an opportunity that will allow us to have a very unique and robust response to COVID and help manage COVID locally. You know, it's not Healthy City Together, Healthy Campus Together, it's Healthy Davis Together. I think it really started with the testing and the testing platform that was developed by UC Davis. And the saliva-based test, which is so easy to administer.
We had the capacity to run a huge number of these tests. We could do as many as 10,000 a day. And so with that high throughput, we said we can not only do regular testing of all the community in the university, but also in the city of Davis and indeed now in Yolo County, our surrounding community in public schools and elsewhere.
I got involved with Healthy Davis Together at the beginning of the project. The leadership team reached out to me. They had heard about some wastewater work that I was starting to do with campus, where we were collecting samples and measuring SARS-CoV-2, and there was the idea to expand this out into the city.
And the same thing too is by having this incredible partnership with County Public Health the way we do, that we can share data, right? And look at case positivity around the whole county.
There's a wide range of interventions that resulted, we think, in lowering the risk of infection. And then, of course, taken to its ultimate level when vaccinations became available, and as they are now, we've seen that a lot of our health education efforts have been focused more and more on kind of overcoming some of the vaccine hesitancy or vaccine uncertainty.
So it's the city and the university certainly, but also there have been other key collaborators in the process. Certainly the business community, no question. The school district is another example. The county in terms of the public health officials there as well too.
Kids are coming back to school en masse, right? So
We've got to figure out how to deploy safe environments for those kids in the schools while there's a high density of kids. It's not distance learning anymore. It's not small classrooms. It's full classrooms. So it's really going to put some of our principles to the test, and we're going to have to see how well mass testing works.
In addition to our regular testing of our employees and students, we tested over 9,000 individuals last week, 10,500 in total as they moved into the residence hall space.
We were testing everybody, and including family members that accompanied the students to help move in. We were giving free testing to them as well. I think there's emerging evidence now that we've had a very big impact, that we've had lower case positivity rates in Davis consistently. We saw this divergence of case positivity between Davis, Yolo County, and California, which is very consistent with the intense efforts that we made here in the city of Davis.
The city of Davis is a relatively privileged community, socioeconomically, and we thought it was important to not just offer what we were offering to a community of privilege like Davis, but also to reach out into the broader community, which did not have the same sort of advantages. But I think in this circumstance, we've demonstrated to the surrounding community what the benefit of having a major public research university in their region can actually be. And I think there's a great deal more appreciation for the university as a partner in the community.
The university and the city had a low point, probably about a decade ago. And we've been really working to bolster our relationship. But this relationship, this partnership on Healthy Davis Together has just absolutely cemented the relationship between the university and the city.
The magic ingredient to the success of Healthy Davis Together was what I'll call a coalition of the willing. We had a willing community that was willing to step up and really take on the best practices of being safe and healthy.